You're listening to Streetside, a Street Medicine Institute podcast.
Hello and welcome to Streetside. I'm your host, Michael Brennan, and this is the official podcast of the Street Medicine Institute. And tonight I have a great guest. Seth Campbell is a physician assistant and program director of the Street Medicine program of Valley Health Partners in Allentown, PA. Seth, welcome to the show.
Thanks for having me.
Yeah, it's good to have you. And I got to paint a picture for our listening audience that Seth is wearing his trademark backwards baseball cap. He's a tall, lanky guy. And I first met Seth in 2022 in Toronto at the International Street Medicine Symposium. We connected again in Kansas City in 2024 at the symposium. I just always liked talking to Seth. He'd been in street medicine longer than I had, and I find him full of insight and wisdom on the practice of street medicine. So Seth, tell us a little bit about your own personal journey towards working with those experiencing homelessness and street medicine. How'd you get here?
So I was lucky to go to the Sales University in Center Valley, Pennsylvania. And while I was there, I met Brett and Corinne Feldman. Corinne and Brett started the program here in the Lehigh Valley through Lehigh Valley Health Network. And when I went into my second year, I had a rotation with Brett Feldman for 5 weeks, and I basically never left. And I also had the fortune of Corinne Feldman being my advisor in PA school.
Most of our listeners would know of Brett and Corinne, but can you tell us about them? Who are they?
So, I mean,
Brett's been on the program.
Oh, then I would recommend you searching that podcast and hearing directly from him. But you know, he's been a great mentor to me, and same with Corinne. But both PAs that found themselves in the Lehigh Valley, and you know, with a drive to serve folks living outdoors. And Brett and Corinne started the free clinic at a rescue mission in Allentown as a part of the Sales University. It was a student-run clinic. From there, I know Corinne was a PA and then got into academia. Brett continued internal medicine, and he started to get consults for primarily inpatient that were homeless. And he became known as that guy, and eventually got on the phone with Jim Withers, apparently hiding in a stairwell, away from patient care to, learn as much as he could, and eventually started one day a week following up with patients that were not going to the free clinic at the shelter. And that's kind of how street medicine was born here in the Lehigh Valley through Brett and Corinne.
Okay, and they're now out in Los Angeles.
That's correct. In 2018, they moved from Allentown to LA to start street medicine with USC,
which is a massive program. And
big
70,000 homeless people in Los Angeles, and they're at the vortex of it.
Yep. And I mean, I'd recommend watching Brett Feldman's TED Talk. That'll kind of share his kind of Batman origin story into street medicine. But I mean, as far as advice in street medicine, I mean, he's definitely, both Corinne and Brett are both guiding presence for new and existing programs.
Great. Okay, tell us about Valley Health Partners. What is that, a community health center?
So it is a federally qualified health center lookalike. So we don't have that full designation. So we don't receive that federal dollars and don't have the malpractice coverage, but we do have benefits through the government with the lookalike designation, including an enhanced rate. But Valley Health Partners is its own business, separate from Lehigh Valley Health Network. However, a lot of the practices were from LVHN in our area: primary care, Center for Women's Medicine, LVPP, internal medicine. They also brought on vision service, chiropractor, dental, behavioral health, veteran health services, enabling services for wraparound support, and obviously street medicine. So in 2020, July, those practices from LVHN came over to form this FQHC lookalike.
Okay, and how long have you been the program director of the street medicine program? When did that start?
I want to say in 2022, maybe.
Okay, right around Toronto.
Yep.
The Toronto Symposium. Okay, so you were new in your role.
Correct.
Okay, tell me about what you do. Tell our listeners. Most folks are familiar with street medicine, but what's unique about your program?
I have to give it up to our staff. We got a great crew, and a rather robust program for the number of folks who are staying outdoors in this area. But as far as my role specifically as a program director, I certainly have some leadership roles and attend the meetings and try to represent our work and ultimately our patients, trying to have a seat at the table for our various programmatic needs, all the way from, time cards to, just advisement. Beyond that, though, about 80% of my time is clinical. So I'm out on street rounds. I, do clinic work, and kind of try to maintain a presence out there, because I'm pretty firm in my belief that this work needs to have leadership who is actively doing the work, because the streets and your patients need to guide your program. And, I just, it'd be a difficult thing to do from behind a desk.
Tell me about the streets of Allentown. What's it look like, the number of unhoused individuals, or how do you structure your program? Are you setting up clinics in existing facilities? Are you going out on the streets with backpacks? What's it look like?
A little bit of everything. So I guess I'll base it off of, and I know we keep saying Allentown, but we cover Lehigh in Northampton County. So Allentown, Bethlehem, Easton, up into Whitehall, down into Quakertown. So it's a pretty decent sized area. But as far as structuring our service, we meet as a team every Wednesday for our huddle for 2 hours.
Wow.
If you miss huddle, you don't know where you're going to be. You don't know what's happening. So it's a very strategic meeting, and I guess something that isn't necessarily unique, but something we've recently adopted. And it sounds like Dr. Jim O'Connell up in Boston Healthcare for the Homeless. I read his more recent book, Rough Sleepers. They would have their meetings and they would review patients. But we specifically, and I want to say they did something similar, but we kind of adopted the same thing, that our meeting starts by everybody one at a time sharing who's on their mind, living, deceased, our patient, not our patient, somebody that we need to follow up with. But ultimately, if something's bothering them, or even they want to give a praise or a shout out, we give that space to kind of review things. And it's been a very helpful thing as we, navigate some of the challenges that our patients face and try to help them best reach their potential. But so we start with that with our weekly huddle. It almost takes the full first hour. And then we have a Word document that kind of brackets out Thursday, Friday, Monday, Tuesday, because those are our primary days that we're out on street rounds and clinics, soup kitchens and shelters, and then back on rounds in the evenings, or excuse me, in the afternoons. And then in the evenings, this time of year, there are multiple warming stations, and we go there for clinic. We actually doubled up our evening clinics this year. So it really kind of, I want to say here, huddle is everything, because and it's an opportunity for us to come together as a team, because everybody's there. And if
how big is that team? How many are you?
So we have 11 full-time staff, 2 per diem, and 1 part-time, and 1 MA role that's full-time that we're looking to hire.
All right, we'll put it out there. What are the roles? How many clinicians? Do you have peer advocates? Do you have mental health? What do you got?
So, and this also is what probably makes our program unique. So we have 3 medical providers. So myself as a PA, Ruchi Dalal, who's a PA, and Camille Hamilton, who's a nurse practitioner, but also is a PhD. So it's Dr. Camille Hamilton. We also have a behavioral specialist on our team, Matthew Burkett. He's an LPC and has been doing this work for a long time, but provides, behavioral services directly in the streets, psychosocial therapy. And I mean, his schedule is full. Going from there, we do have a full-time nurse as our clinical manager, Eric Rivers, who primarily provides that clinical support, but also has managerial roles. We also have a site manager who does a lot of the behind the scenes, John Cabot. And next, we'll go to our criminal justice navigator, which is a unique role, JJ Rivera. This role goes into the local jail, connects with our folks who are there or folks that are going to be released to the street, helps care coordinate, advocates, goes to court with them. And then when they are released out the back door, we see them in the parking lot right upon their release.
Wow.
And it's been a great service. And then they follow them in the community, providing whatever supports that they need, and have shown significant decrease in recidivism rate. And he is paired by Joshua Newland, who's our certified recovery specialist, lived experience that he shared openly, and is not only a great resource for our patients, but a great team member and to provide guidance for our program. We also have a medical assistant who is now our care continuum partner who does all of our scheduling and a lot of behind the scenes. Idelise Rodriguez. And after that, we have our community health worker, Patrick Smith, who's been with the team for quite a while. Not only does he do a lot of assistance in the field for our patients, but also helps folks with insurance and applications online for food stamps, PA Compass, if you will. We have, again, I said 2 per diem staff. They're both nurses, Julie Moyer and Colleen Stalin. So they're on 10 hours a week, varying times, varying locations. Julie Moyer primarily supports our medical respite program, which we can get into. It's private philanthropy and grant funded. So sometimes the money is there, sometimes it's not. Colleen Stalin has certification to be able to do foot care. So it's another unique thing that we do. Warm foot soaks in clinics, even out in the woods. We'll carry out hot water and do and clip the gnarly nails and whatnot. Just about, I'll do that. Ruchi will do that. And Colleen does it primarily. We also have Ken Ziegler, who is our clinical assistant. He is part-time. And we also take a ton of students. So primarily PA students from DeSales and Bridgeport, Connecticut. And I want to make sure I'm not missing anybody, because if anybody listens to this, they will let me know that I'm missing them. I guess before I continue with our crew, we obviously have we also have great leadership. It's certainly fertile soil, as Brett would call it, at Valley Health Partners to do this work. They have our backs. They are supportive of us, from our VP of operations to everybody in our C-suite. We meet with them quarterly and regularly in meetings. And if I needed to have them on the phone right now, they would answer, and we would get things done. I mean, I'll share, Amanda Valerio, who's our COO now. At one point, she was VP of primary care, and I was on the phone with her because there was an issue with patient care, and she was like, "Well, where is this patient?" And I mentioned where he was, and she was like, "Oh, I'm just down the street." And she was with her husband driving, family in the back of the car, and this patient was Spanish speaking. She spoke Spanish. She went to this alleyway, found him, and he actually, there was concern that his tent was leaking ultimately, and that he was going to be wet and it was going to be freezing temperature that night. And sure enough, she was there with her family, talked to the patient, ultimately ended up calling the ambulance because he needed it. So that's the kind of leadership we have at Valley Health Partners.
Oh, that's fantastic. Fantastic. And I was really impressed with your team, to have a criminal justice navigator, certified recovery specialist, medical respite. It sounds like you've got your bases covered. Tell me, you mentioned going out in the woods to take care of patients. What is your program predominantly urban or more sub-rural kind of? When you mentioned the whole Lehigh Valley, what are the environs that you're working in?
So I know that Allentown's the 3rd largest city in Pennsylvania. As far as exactly what that means or entails, it's hard to say, but the majority of the land is being developed, whether we like it or not. And the city itself, each city is surrounded by wooded areas, if you will, along rivers and embankments and under bridges and whatnot. There's a significant portion of wooded area that our folks somewhat retreat to, because ultimately they're not welcome to stay directly out on the street. Bad things happen when they stay there. So, they've, again, retreated to under the bridges and out into the woods. And with the tagline of, street medicine is to go to the people, that's exactly what we do. And just over time, we've come to know where folks go, and our primary referral source is our patients.
Yeah. Word of mouth. And tell me, Seth, I'd like to hear a story of a patient. You've been doing this for years. Do you have a patient story to share with our listeners?
There are many stories. I mean, happy, sad, very, very sad, very, very happy stories.
Does one pop?
I know they say that you shouldn't have favorites, but everybody has favorites. But I'll say, a story that comes to mind is just of a patient, and she has been such a success story and such a great example of perseverance and just the ability to change and move forward in life. That she used to live out of her vehicle every once in a while. She would be able to find work and worked even through COVID. She worked in nursing homes and various factories, living out of her car. And I just, recall seeing her at that time. She smoked, terrible asthma, terrible asthma. And she was in her car staying, and it snowed the night prior. She stayed on her car in the parking lot of the factory where she was working, snowed in, no gas. She had called noting that she had turned on her car intermittently throughout the night just to stay warm so she could make it to her next shift. And we brought out albuterol inhaler. We actually found these portable nebulizers that we use. Got her some treatment for that, but also brought some gas to put in her car. Which I'm sure that's probably not allowed, but do things that aren't allowed all the time. And just following that, she was able to quit smoking. She got her asthma under control. She was able to establish a transitional housing, and she's been housed for many years now. And, from where she came to the first day that I met her in full tears, having lost everything, to where she is now, she's just such a light. And I guess that's all I'll share, because I can't get into any more specifics. But another gentleman who hasn't unfortunately passed away, a great teacher of ours, over his time on this earth, he did suffer with some significant alcohol issues and drinking, all the way to frostbite and losing his toes. And every time he'd leave, you would just hope that if he did find money, he'd get an extra tank of propane to heat the back of the truck that he was staying in, a trailer or tent or whatever it may be. But usually it did go to alcohol. But every time that I saw him, at the end of almost every encounter, we'd be having a nice conversation like you and I are having, and he'd look around and he'd look at me and he's like, you know what? I don't like you very much. Get the out of here. And he's like, and he's obviously joking, but he's like, he knew that we had other people to see. He knew that, we were there for quite a while. So he's like, so I think it was his kind way of saying thank you.
Time to move on. Yeah. You seem to enjoy what you do. What brings you joy in your work?
I mean, it's obviously the meaning and purpose that I get from this work is, goes without saying. And it's, it's an opportunity to give grace, because it's, something that, I've been given a lot in my life, and, it's inherently biblical. I'm a Christian, and, that really guides a lot of what I do. I don't, talk about it a ton, but, there's a lot of prayers that go into this, and there's a lot of, I would just call it, grace and faith that goes into this work. And at a recent memorial service for one of our patients, our original outreach worker, Bob Rapp, is now a reverend of a church. He also runs a emergency shelter, but he had a memorial service for a patient who passed away in her 70s, known to many people. And during this memorial service, there were, I counted 112 people there at this memorial service. And the patient, if you can close your eyes and imagine the classic elderly lady with one tooth on the street with many bags. That's this patient. And in Bob's words, when he was, sharing about her life story, he looked around the room and he said, a lot of people were affected by her, in this room. And you probably had some level of service that you were providing to her when she was here. And then he just said, but who really benefited from that time, from that service? Was it her or was it you? And it's obviously me.
Yeah. Thank you for that. A reminder that the gift is coming in our direction.
Mm-hmm.
The grace. Yeah.
Mm-hmm.
Yeah. Thank you, Seth, for sharing that. And I'm gonna ask and change gears a little bit on you. And
Sure.
If there's a lot of folks around the country thinking about starting a program, or just started one, or just dabbling in street medicine, and what, from your vantage point, what advice would you give to these nascent programs that are trying to get off the ground? What have you learned?
Well, for any budding program, I'd certainly say, to map out the area and see what already exists, because, especially for some outreach programs that have been around for a long time, if you're the new kids on the block coming to save the day, I'd watch that approach, because there's a lot to learn from existing organizations, soup kitchens, churches that do some semblance of food or shelter service, to learn from them. And then ultimately, to have the understanding that you will need the help of that community that has already existed to be able to provide the service. Nurse Jackie, original parish nurse at St. Luke's, her retirement party is tomorrow. And I don't know how long she's been a nurse there, but ultimately she helped Brett get this program off the ground inadvertently. They were just at the same soup kitchen together. But from the beginning, by Brett associating with Nurse Jackie, he was in. And Nurse Jackie saying, Brett's a good guy, and he is.
Right.
That's how it all works, because your reputation is everything. It's not what you say, it's how you say it, all of those things. But if there's nothing there, if there's no services, there's nobody that's ever provided a hot meal to somebody, there's nobody that's ever provided shelter. Okay, then you don't need to learn necessarily from the other service providers. All you need to learn from is your patients. But beyond that, with knowing and mapping the area, is there a huge health system that maybe you should be partnering with? Is there a medical school? Because it's inherently a classroom for students, not in any means of voyeurism or any of those negative connotations, but there's a lot to be learned by students. And really, when students come out, they remember why they went to school in the first place, to do something like this.
To be of use.
Yeah. So
yeah.
If you could partner up with a school, I'd recommend that, or a medical school, PA school, nursing school, and just ultimately staying within scope. You don't want to do things that get you in trouble early on.
Yeah. Good advice. Seth, I want to ask you, there was a time you told me about your help for the patients experiencing homelessness with their vision, and you described some contraption you put on, like VR goggles.
Oh my gosh.
Tell our listeners about that.
So yeah, I didn't mention we've now Eric Rivers, our clinical manager, came up with the acronym of the FROGS unit, and it's something along the lines of field-based refraction,
ocular
on-site glasses service. Because it started with an autorefractor, the whole portable autorefractor. I want to say it's Planoptica is the unit. We don't have any, I have no disclosures, but that was showcased at Toronto. So we were able to purchase one of those through a donation, and we're getting the prescriptions. It's a big Binaco looking job that spits out an electronic prescription for your eyes in like 10 seconds. And then we were ordering the glasses online, having them come to us, and then couriering them out. And then we had a PA student, a medical student, Tasia, come to us and say, hey, I want to go in ophthalmology. I want to do this capstone project with you guys. There's this kit that has lenses and frames, and we can build them on site real time. And street medicine is service on site real time wherever the patient is. And I was like, okay. So again, we were able to find funding to buy this first kit using the autorefractor that we already had. We were able to get the prescription real time, and obviously have to pass a screening test to make sure they don't have some sort of terrible glaucoma or cataracts. But if they pass that and they don't need to go to a formal ophthalmologist right then, we are able to get their prescription, go in this plastic case of lenses, and pick them out, and then we hold those lenses just up to their eyes and say, can you see? And they're like, wow. And then we go click into the frames.
Love it.
Yeah. And
Love it. Yeah.
And
actionable results from the testing and immediate process.
And, if this was
people must love that.
Oh, if this was a video podcast too, I mean, I wish I could explain in words the putting glasses on somebody and them just looking around, looking up, turning their head, and they're just saying, wow.
Yeah.
Looking around. It's like,
right.
Especially like real time, not let's wait a month until we get these glasses couriered out to you real time.
Yeah, that's fantastic. Seth, we're coming down to the end here, and I'd like to ask my guests a question. What's the question you wish I had asked? What haven't we talked about that you'd like to share?
What not that we haven't shared?
Anything?
I mean, there's so many things to discuss in street medicine, and I could talk to you about this to a very, very long time, to the point that my wife would get upset that I'm up here.
Right. Yeah, talking about street medicine. Yeah. Okay. All right. So maybe take a pass on that question. I've got another one.
Okay. What's the other question?
Yeah. The next question is, we ask all our guests, if you could do one thing to make the world a better place, what would it be?
If I could do one thing?
Yeah, one thing that you could do.
Take a break here because I gotta I gotta really
That's right.
think about
I
this.
can edit out silence. That's easy.
Can you ask the question again?
If you could do one thing to make the world a better place, what would it be?
You know, as a program director, and as a PA, I often focus on my patients and I get very focused on my patient care. But I probably should be more focused on the staff who are also doing the same work and trying to make their work environment better. Because obviously, when you come into a work environment that you really love and we have a special thing going with our staff, but just making it that much better, their experience as they're going day to day and their work, ultimately the patients will get better care, they'll be better at home. And something I guess I'd recommend for programs and people in general, we have established a check-in, check-out process, and it goes something like this. What letter grade are you today? Instead of a number system, are you an A, B, C, D, F? You know, if your dog died last night and you're an F this morning coming to work, we want to know that so we can extend a little bit extra grace your way rather than, you know, middle of the shift or middle of the morning saying, you know, what's wrong with Julie, and getting upset and frustrated. So I guess the answer to your ultimate question is just giving people more grace at work, at home, in traffic.
Yeah.
I think that's what we need.
Yeah, that last one is the hardest of all. Yeah, well, thank you. Thank you, Seth. This has been fantastic. And how can our listeners connect with you if they wanted to reach out?
So I believe there is an email and probably a phone number at Valley Health Partners. If you Google Valley Health Partners in Allentown, I'm sure you can find the street medicine program. There might be a link to HR or directly to our program. That being said, I mean, if they're able to reach back out to you, I'm happy to share my email or I mean, even my phone, because I really firmly believe on the idea that we should be talking to each other, hearing the inflection in our voices, because sometimes emails and text messages can be taken the wrong way.
Yeah, that's so true. Yeah, Seth, this has been fantastic to talk to you. I so appreciate you taking the time out of your busy schedule to tell us about your work and your patients and all that's happening in the Lehigh Valley of Pennsylvania. So thank you, and we appreciate you being on the program.
The Street Medicine Institute is a secular, nonpartisan organization. Any spiritual or political views shared by guests on Streetside are their own. They're offered in the spirit of conversation and should not be taken as reflecting the views or positions of the Street Medicine Institute. This podcast should not be used for personal medical guidance. Please consult your healthcare provider.